This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about how to tell if you have piriformis syndrome. And if you like this video, we put out new content weekly, so please like and subscribe. So piriformis syndrome basically means that in one of the muscles in your butt, it's a smaller muscle, pushes on this nerve that's also kind of in your butt area called the sciatic nerve, which is the biggest nerve in the body. So the sciatic nerve's coming down, piriformis sits like this, and if you get piriformis syndrome, it'll just squeeze that nerve and you get sciatica, or pain that kind of goes from your butt down the back of your leg. So how can you tell that if you have this? Well, first of all, if you have piriformis syndrome, you'll have sciatic symptoms. So if you have pain in one of your buttock areas and it travels all the way down the back of your leg, you might have it. The second way to tell is you take your finger and you kind of poke right into a spot, and if you have a very tender spot in your butt, like in the meat of your butt, that causes pain and sciatic symptoms that travel down your leg, then you might have piriformis syndrome. Another way to tell is if you kind of cross one leg over the other and it really stretches and you want to kind of recreates that pain, that's another way to tell as well. There's not really any good x-rays or MRIs or CT scans or nerve conduction studies that are really going to tell you have piriformis syndrome. And that kind of area is a tough diagnostic area. The hip's deep, you have the sacroiliac joint, you have back pain that can be referred. The biggest thing is to differentiate it between a slipped disc in the back, and there can sometimes be some overlap. In both cases, nerves are being compressed. One's just compressed by a muscle and one is by a disc. But there's a lot of people that do have piriformis syndrome that kind of get diagnosed with back pain, and they get all these treatments for back pain and never really get any better when it's actually piriformis syndrome. So again, relatively easy to tell. If you have sciatic symptoms, you poke yourself. If you have a tender spot right in your butt where the pain travels down, you probably have piriformis syndrome. You could also have back or other issues, but that might have piriformis syndrome as well. And if you've got back pain, sacroiliac joint pain, sometimes the piriformis kind of tightens up to kind of protect yourself from that as you have altered biomechanics, and that'll kind of make it come on as well. The treatment, just a whole lot of stretching. Sometimes I'll inject them with a steroid and that'll kind of calm things down and allow it to stretch out. But really, whatever you do, you got to just stretch that muscle out. Surgery for that is very, very rarely done, although there are a few people who do it and do it successfully. So I hope I was able to answer your questions about how to tell if you have piriformis syndrome. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond, but I can't give you specific medical advice about your condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.